Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome. My name is Abby Tyler. I am your host. Welcome to our Tuesday show where we go in depth into different topics. As you can see, the title of the show is Black Health: How to Better Advocate for Yourself and Strategies to Help You, Tips and to help you get better care. So, welcome to all of you. Please share the show. Please invite others. Of course, every time my disclaimer is I am a provider, but I'm not your provider. So, please do not make any changes to your regimen without seeking your provider first. Okay, consultation with your own provider. Okay, so as we all know, this is Black History Month. It's the last day of February, so we're going to be moving on. Tomorrow will be March. So I thought to talk about Black health care. This also applies to like marginalized society communities and also okay, but this topic today is mainly about like African American Black and all that. Okay, so I thought I was a little hesitant in talking about this topic mainly for the fact that I don't want to sound like I'm sitting here placing blame or doing all that, but this is something that we all talk about: social workers, public health care nurses, nurse practitioners, providers, and everybody. Okay, and I saw this nice topic. It was written by this Geraldine Dexter. So I just took her article and I tweaked it around and put some personal touches to it. So I want to give her credit for that. Okay, so this is about to spread, like I say again, to spread awareness against providers and patients and all this for everybody, social workers and all of that. Okay, so they did a survey. So let's start. Let me just make sure before I start. Let me share the show again. Share the show. Okay. I'll put my glasses on. Alrighty, so I'm just going to read something over here. So they did a study. I got this from Very Well Health, by the way. This article they did a series and they did a survey. What they did, it's an exclusive survey. They did about 2,000 people, and 1 in 3 Black Americans report having experienced racism disparity while seeking medical care. And they had like a roundtable stuff with other medical experts and all that. Okay, so let's start about what is called, disparity and all. In 2010, the U.S. government pinned down a definition of health equity as the attainment of highest level of health for all people. That means everyone, regardless of race, socioeconomic status, geography, circumstance, has the same shot at living a healthy life. It was a lofty goal, but trying to work on that. It's something like 2020 healthy people and all the different goals, 2030 healthy goal and all that. Okay, so some of the examples when people say, okay, what do you mean when people say have health disparities, or how do when Black people navigate through the health system? Okay, so I'm also talking about this, and the same way I'm seeing it as as a patient, and almost also seeing this as a provider too. Okay, so some of the examples they talk about health disparities, occur all over the world, also in America also. So and it can affect any race, ethnicity, and all that, but the higher rate of it affecting different marginalized community is totally different from other races. Okay, so infant mortality. All right. Babies born to Black women in the United States die at more than double the rate of babies born to white women. Right. Dementia. Black people have the higher risk of dementia. That's when you lose your ability, lose your memory, and all that for dementia, and are twice as likely to develop Alzheimer's than whites in the United States. Cancer. People with lower incomes and education levels are more likely to get cancer and die from it compared to more affluent peers. And that gap appears to be widening. Obesity. When you're gaining weight, even after controlling for family income, rates of obesity in Black women and Mexican, I would say maybe Hispanic or Latino, African American men are substantially higher than in other race or ethnic groups. And smoking, Native American, Alaska Native men and women have disproportionately higher rates of smoking as the individuals living in federal poverty level and those who are unemployed. Okay. So also when we talk about different major illnesses, Black also have a higher risk of becoming diabetics, have a higher risk of having heart disease, deaths from cancer and everything, also hypertension. If you didn't catch my show last week about heart disease, please go back and watch it that I had with a doctor on there. Okay, so how can you? The main thing about this is like again, this said they did a study in how these black people and white people, and these are the answers that they gave. So how can you navigate yourself? I remember. Let me make this a little more personal. Like I said, I'm saying this also as a patient because when I go to the doctor's office, mind the doctor's office, or go to see a specialist and all, they don't. I'm not going there saying, oh my goodness, I'm a provider. They don't know I'm a provider. To see me, they said my name, my stuff. Sometimes I may bring it up if they're saying something that I already know and I may answer, or sometimes the way I'm asking a question, they can kind of figure it out. Yes, I'm in the health field, but it's not something I really like to bring out. So until they ask me stuff, because I want to be able to get the care as a patient, sometimes not as a provider. Okay. So I remember one time my husband was having some issues and we went to the hospital, and they were saying, and remember the nurse was saying what he was in the hospital for a couple of days and it was supposed to be doing something with him. And she goes, well, if do you do any illicit drugs? And he said no. So I think they had him on a heart monitor and they were talking back and forth with the other consulting doctors there. And she's like, oh, if you do any kind of illicit drugs, this would be the best time to tell us now, because if there's anything happening, we have to do any kind of surgery and all that may affect you. If you do kind of drugs that does anything to your heart, if you go into surgery, that can also affect your anesthesia and everything too. And she kept saying, so tell us now so we know what we're doing. And I just said, hello. No, he doesn't take illicit. What are you implying? You're gonna force somebody to tell you something that is not true? So I said, you might want to, get your manager in here because that is not right. Okay. So by the way, and people have many, many stories on how, to go into the system and meet other people of different races or providers of different races, regardless of whether they PAs or NPs or doctors and all that. And this also, you can also have things with African American doctors too, by the way. So and they have so many stories, and you can say, oh yeah, everybody always crying racism and crazy. I'm speaking more about disparity, and I'm also here to talk about the tips on how to work the system to make the system work better for you. I'm not here placing blame. I'm not here to do that. So please, by the way, if you guys are going to be putting anything in the comment section, Facebook is very particular about what you put in the comment section. And also, I also reserve the right to take anything off that I find to be, disparaging. Okay. So how are some of the ways that you go about knowing how to navigate the system, and some tips to navigate the system that make the system work better for you? I'm not saying that's going to change things. Everybody comes into the system regardless of whether you're a patient or a provider. We all come with our own biases, and that's why most employers now trying to teach, give sensitivity training and different things, how to work around different races, because some people don't live in anywhere, the place where the people look like that. And I talk about a lot about lived experience. So there are places where sometimes you might want to go to somebody who understands your problem, like some dermatological diseases like a rash, anything that affects the skin. Okay, there's some diseases that show up on black skin that looks different on the white skin, and if you don't get the right person who will say, let me look a little deeper, let me go do more research and see, get my book and do more research and say, okay, maybe this is it. You could be looking at something that could just be that maybe just a little rash, eczema or something, and it could be more than that. It could be skin cancer. So you want to have that provider that really understands that has that lived experience. But even if they don't have the lived experience, they respect their patients enough. They respect themselves enough as a provider to say, let me look a little bit more. Let me ask somebody else. Let me get a second opinion to say, okay, maybe what I'm looking at is something that maybe just something I can just order a topical cream for, or something that I have to like send this person to go see a dermatologist, go see other people. Okay. So that's why it's important. So let me get into it. Okay. So I am going to go over here. Let me go to my banner, and I'll be checking the questions and all that too. Okay. So let me just go in here for a second. Okay. So, I'm sorry, Angelina, so let me comment, listen to something. Hi, Angie. I was going to say, come here. Okay, they're both going back and forth in there. Alrighty, so Mr. Taylor said, great, good, good, good. And then it said, much needed topic. Thanks, Abby. Thank you very much. So I'm going to go in here to my banner, and I'll go back to the questions later, okay? Okay, so topic number 1. Let me just go in here and do this for a second. My stuff is acting up, so. Okay, so your first thing you want to do, life stuff, know your rights as a patient. Okay, so Alrighty. So some of the things, how do you say, okay, know your rights? It's important thing. And I see people sometimes they're recording people when they go to different offices. I'm not too crazy about you recording somebody unless somebody is being abused, because something that you can be recording could sound, it could be something that's totally different and you're interpreting it different. Of course, depending on, especially if you're in certain facilities, you don't have the right to record anybody because they're privacy issues. You could be recording, this person, and somebody else is down the hall and you're recording that person. Who knows if that person's on a like on a custody, and that person doesn't want the whole world knowing where they are. It's very important that you don't do that. Okay, but again, I cannot control that. Alrighty. So know your rights as a patient. Okay. What is the first thing there? Respect for interactions. You should be treated with respect at all times. It's very important. It's not like, okay, you're the doctor and I'm the patient and I'm just supposed to listen to everybody. Even what the provider should know, that you're supposed to respect your patients and speak to them as, respectfully. As required by the HIPAA thing, the Portability to Privacy Act, you have a right to have your personal health information kept private. You also can obtain your medical records at any time. Now they might tell you that yes, you can get it right away because they have to compile it. Like sometimes when I see my patients, I don't do my charting like the same day. So if you say I want my records right now, there's no way we can print it out right away. So it's important that you understand that also, and you can call for that later on. There's in the hospital now where you're in, patients can go right into the portal system and just read their records right away. So literally, the doctor might walk out of the room or the nurse might walk out of the room and document, and you can have your records right away. Some hospitals do that, some hospitals don't. There are many reasons, and also the laws are different in different states too. So know what ask about the laws in your state. Okay. Autonomy in making decisions and choosing the treatment that feels best for you. That's a little iffy too, because they might say, oh, your provider might say, let's do this and let's do that. You might say, oh, well, I read somewhere and I don't want to do that. And you both can come to an agreement somewhere, but don't make it so adversarial. You're both arguing back and forth. Of course, like again, I did a show on don't try to diagnose yourself from the internet. You might say something or might say, oh, my friend also didn't do that and they did something else. And why are you doing this to me? Now your friend don't have the same medical history. You don't have the same kind of labs and everything else. So talk to your doctor, have a nice sit down, and you guys can come to a conclusion. Okay. And sometimes you have a right to say, no, I don't want to do it. And we also have a right to write down, say you decline the treatment. Make sure that they explain to you. Of course, we're going to discuss that, the fact that we explain everything to you, the pros and cons, and you decided against it. Okay. Information for healthcare, including your risks, and also we explain to you the risks and benefits and all. And understanding your rights as a patient is your first form of self-advocacy. Okay. So most of the thing here is like you want to understand. So the next one you do, how to go about doing that, is learning the basics. Okay. So learning the basics. Again, research as much as possible. Again, don't just research things where you're researching topics and people who author things that just satisfy what you already know. Okay, like I say, information bias. Okay, this person said, oh no, you can't do this, and that's the only place you read something else that somebody speaks against it too. Okay, so you get a better idea, wider range of what it is I'm doing. I'm looking at the wrong part. I'm looking at the pros and cons. So don't just research with people who believe things you do. Read the other side too. And when people say research, most people I know, they're like, they just read articles. There are info articles. It's now infotainment. Okay, it's not something peer reviewed. They just read something online where anybody read it and be like, I did my research. No, most of those people don't do any research. Their research is basically listen to somebody on some blog somewhere, or watching a 3-minute video on TikTok or IG. Okay, most people don't do their research. Trust me. All right. So, but do your research, maintain good health when thinking, know everything about your gender, your race, not everything, family history. And so that way, when you go into your doctor's office, you have all of that. So you're not going there because you go in there with a mistrust anyway, thinking that, oh my goodness, these people are going to see me and they're going to be doing something else to me. At least that way you go in there, you arming yourself with that knowledge. So when you go in there, if they say something, you'd be like, okay, I know, okay, this is for Black people, this is what happens, and we are at a higher risk of this. Also, for my race or my also you also remember for foreigners too, because I'm talking about African Americans, Black, and all that too. But sometimes you get Black people that are in the diaspora. Okay, so they may be seeing something different too, and sometimes they see you differently too. We also have providers where there were times where places that I worked before where the providers spoke with a different accent, and there were employees there who were making fun of that provider. because they think, oh yeah, because you have an accent, so you must be stupid. I don't understand why they equate having an accent to being stupid, but every time they do that. So people who have accent, I have an accent. Sometimes people might look at you and think you're not educated as a person who is more, who has the American accent. So we get it both ways. Okay. So make sure you, like I said, you learn yourself when you're supposed to get your checkups and all that and go through that. Learning about your family history, identify your own risk and all, because when somebody come in and I say anybody has cholesterol, high cholesterol in the family, anybody has heart disease, so I'm asking those questions. And some people take it back, like, why are you asking me all those things? Why are you asking me things about my family? Well, then I have to explain to you, yes, you have a higher risk of developing certain things when you have family issue, when you have family genetic components. So I need to ask all those questions about that. So when they come across and asking those things, that I mean is trying to say, okay, yeah, you're definitely going to get it. They're just trying to ask those questions so they can come to have a bigger picture or a better picture on how to treat you. Okay. Alrighty. Also, I did the research and learning about your insurance coverage. That's very important because sometimes you go there and they tell you, oh, we can't do this, and you get pissed off and you're like, you go in there already. So you have to know what your insurance coverage covers. Okay. So if you have insurance, making sure you research, understand, like if you go for a visit, how much it's going to cost. If they tell you to follow up, to if I come back into the office, is this going to cost me more money? If you order this medication, is this going to cost me more money? Can we work about it? Can you tell me, okay, what if I want this thing and this medication really works for me, but the insurance company says that I can't get it? Are you doing that because I'm black? Are you doing that because you're not fighting for me? There are times where when I order the medication, which is like the first line medication, and insurance company might say no. There are times to say if you want to appeal it, they will tell you to send a letter to the patient. Also, if you want to appeal it, you can have your doctor call. There are times I've been on the phone and I'm talking to their insurance company doctors, and sometimes I get through, and sometimes they're like, no, they have to try this, and this first, and or sometimes the insurance, their coverage, you don't have that kind of coverage that covered that. Okay, so we're fighting the back for you too. Okay, like again, the most important thing is like communication and just keeping an open mind. Okay. And so like again, like I said, if they prescribe a medication, sometimes that's just the best medication for you. But some insurance company may say no, Medicare or Medicaid, and all they might say no, try something else. And we do fight. We get on the phone and we talk back and forth. And sometimes the answer is like no, it's still no. They have to try something else. And sometimes they surprise and they'll be like, oh, okay, we'll do it. We'll do this testing. We'll do this. Then do this lab. We'll pay for this. Pay for that. Because sometimes I have to say, would you rather pay? Why not pay for something that's not that expensive as opposed to waiting until the person gets sick and you have to pay for a hospital admission and all. Okay. So know what your insurance and your coverage and everything, what it's going to entail when you go in that room. Again, you want to arm yourself with everything that you need to know when you walk into the doctor's office. All right. Let me see here. And sometimes, like, again, like I said, they might say it's not necessary. Then you can fight against it. And sometimes it's no. So know what your insurance covers. It's hard to know all the different fine prints, but it's important to kind of, read over it, look at the major points. All right. What do you do if you don't have insurance? There are so many local agencies, state-funded programs, and variety of health and behavioral services. You can ask the social service department in your state. There's the county health department. You can go there and they can give you different resources. Even your own doctor's office, if they have the social workers working there, care coordinators, you can ask them and they can give you that. So sometimes if you don't have you may be out of work or you may be in between jobs and you really need insurance, you can ask for that. Okay. So it's important. And also, there's also, you can find services by calling 211 and also healthcare.gov. Okay. So they can give you more information about that. Okay. So, and some of the questions that they talked about too, they said, encountering racism during the health appointments, because they asked these people, again, like I said, they did a whole survey and asked these people, when do you really experience racism or also any kind of health disparity? Okay. So, it said, well, the survey showed that Black Americans use the healthcare system as much as white Americans, with 75% of Black and white respondents reporting seeing a healthcare professional in the last 12 months. However, taking the same action doesn't mean the same. So due to experiences, let me go in here, Black Americans, because they may see something and the way people treated them, so the way they come across, they're really less likely to report positive perception of doctors, nurses, and physician assistants, and also NPs, because they see that and they might say, oh, no, I went there and they treated me this way. Some of these people, and I won't go there. I won't have that doctor. You have every right, again, to be respected. And if you don't feel that you're respected or treated right, you have every right to go to a different doctor. I did do a show on how to switch doctors and all, how to do it safely, because you don't want to say, oh my God, I can't stand this doctor, I'm going to another doctor. And in the middle of the time where you're supposed to be getting your medication renewed, or also getting your physical or your clearance for your surgery, that is not the time you want to be searching for a different doctor or dropping one doctor, because what's going to happen is going to delay everything you're supposed to be doing. And some doctors are not taking new patients either. So it's important to do that safely. Okay. You have a right to call the doctor's office and say, can I come in and talk? All right. So let's go in here. They say they experience let me just open this up here for a second. When they experience racism more. Okay, research noticed that Black Americans are less likely to access care for preventative, acute, or chronic needs. However, the study discussed another significant problem that patients face: implicit racial and ethnic bias, negative attitudes of healthcare professionals towards Black patients. So systemic, most of the things they said, they view Black patients are less intelligent, more likely to engage in risky behavior, because sometimes I need, again, like I said, she was questioning my husband. Oh, do you do any drugs? Do you do anything? This is the best time you need to tell us that if you do any drugs. And sometimes there were times where, other places where the first thing to do, let's stick your urine for drug screen. It's like, okay, you must think I'm doing. I mean, if you can tell the bias, because sometimes it's like, would you check for drugs in somebody else's urine if you didn't think that person was doing drugs? So try to open your mind. Again, we all come our own biases, regardless whether we're Black or white. We all come our own biases, and that lived experience can also affect that. Okay. Again, this is also to providers, social workers, and everything. And this is something that we talk about from continuing education many times too. Okay. It's talking in marginalized society and special populations. Okay, and also they think Black people will be less likely to stick with any kind of treatment recommendations, because sometimes so I know some patients too where I tell them certain things and then they come back and like, you didn't think you were supposed to take your medicine, and it's like you tried, and you don't want to sound like you some kind of manager over them or trying to like brutalize. So I said, but I told you to take your medicine. Your blood pressure is even higher now, or your cholesterol level is even higher now, or now because I need to send you to a specialist because you didn't take care of this long before. Okay. And everybody wants to say, I was feeling good, so I didn't take it. You give me my antibiotic. I took it for a couple of days and I felt better, so I didn't take it. You're supposed to take it all. Okay. And then, but if that person thinks that, oh, this person who doesn't look like me telling me these things, I'm not going to do it. Okay. Or, would they do that to somebody else? So again, we live in such a racially charged society now. So that doesn't stop when you come to the doctor's office. You come with your own biases, and everybody coming with their own. So we're all human. Bottom line, we're all human, and sometimes we err, and it's like open your mouth. And if you do something or you say something that you think that may be prejudice or prejudge this person, it's always good to step back and say, okay, let me listen to you. Okay. And sometimes when you're in the doctor's office, sometimes the doctor or the provider has come from another room where they got cussed out. Okay. They still cuss us out. All right. And then you come into another room and they may seem that they're being short with you, that it has nothing to do with you. And sometimes it's not easy to just turn that off. Okay, somebody just cuss you out, or one room was so tense because it ran over for so long, and you have so many patients in another room, patients in the waiting room and waiting. That makes you so tense. Sometimes it's not easy to just cut that off and say, beep, 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 how you doing? Sometimes so you may come across as, well, okay, she wasn't that, is it because I'm this color, or because she's that? Sometimes that has nothing to do with you. But I can go in your room and start complaining about the other patient that kept me long over. So it may be a little short, but give us some grace. Basically, okay, give us some grace. All right. So because of that too, right? So people notice that and say, okay, 1/3 of Black Americans experience racism as they navigate the system. So I already talked about that. So according to Black participants in the group, they experience racism at different stages of their healthcare, but mainly during appointments with provider. They also experience it during the scheduling. I guess when they call, and the medical assistant can be a little bit off-putting. Checking in when they come into is like all the different attitudes. I don't see the checking in part. I'm seeing other patients. I'm in the back, and also as a patient, sometimes I may come across and be like, gosh, she had a little attitude, or he had a little attitude. Why are they acting like that? Remember too, they're also dealing with a whole lot too. It's not they're just sitting there getting information. They're checking insurance. They're doing things. They're calling back and forth. They're dealing with me. They're dealing with everybody else. So sometimes, again, this is all about giving people grace and also teaching those people that yes, you may be going through that, but I'm the patient and I'm going through this. So also show me grace, show me respect. Okay. Leaving appointments. Sometimes, something you have to call the person back and say, no, you have to make an appointment, you make a follow-up appointment. So it's just the way you're talking. All right, we learned this thing in when we were when I worked in the hospital. We did that. What the head? If any of my coworkers, my former coworkers, are watching, the head, the heart, and then the head. So it's a sandwich. So it's all about how you speak to the patient. Make sure you speak with your head, but make sure you lead with your heart. Okay. So head, heart, head, the sandwich thing. So that model, making sure that you see the patient in you. There were days where it was like, okay, okay, and then follow up to it, right? So let me just go in here. So again, it said racism is dangerous for Black Americans within the healthcare system as it can hinder or interrupt care. All right. So it's important. So, for example, Black Americans who experience racism in healthcare changed providers. 36% of the time, did not follow up for 28% of the time, and delay making health decisions 28% of the time. These interruptions can have numerous consequences for Black Americans and their well being, as well as confidence in seeking care. Alrighty. So I work in Philadelphia, and I'm one of the people who like the list as one of the Black providers in Philadelphia too. So I guess that I know, but I mean, I like I said, most of my patients, I also work in a heavy immigrant community, so they're not Black American. They're not Black immigrants. They're different immigrants. So I treat everybody with respect, because when I walk in the room, I want you to treat me with respect. So when I go into my patient's room, I treat them with respect. Okay. Sometimes when they're yelling and all, I say, hold up, hold up. You want me to respect you? Please respect me too. Okay. And also as a foreigner too, sometimes I get it back too from people who look just like me. It's like, okay, they may be thinking that I may not be just as smart as my partner or other people they have dealt with too. So the most important thing, how can you work around that? Finding, let me just go in here, hope my stuff is coming to find the right healthcare professional. Okay, so here are some of the questions you might ask when looking for a medical professional. Okay, so the things to consider: what are your medical needs? What kind of healthcare provider you need to see? What education, training, specialties does the provider have? Some people say they don't want to go to anybody who's like, if I look at their ratings and they're like less than 3, I don't want to go to them. Are there any reviews for this provider? And sometimes the reviews, somebody would do have one problem. The people who love a provider, they usually don't write reviews. The ones who can't stand somebody is the one that write these reviews, and people see that and then right away to believe that. So keep an open mind when you're reading those reviews. Okay. Are they affiliated with any specific hospital system? So sometimes some people, which hospital they go to, whatever the hospital their insurance send them to, sometimes they want to get a doctor that's affiliated with that hospital system. Okay, so it's important to, find a provider who treats you with respect, listens to you, adequately address your concerns and all that. Okay, so how do you do this? The most important thing is preparing. I didn't want to make this too long today. How far are we into this? So I didn't see any questions there. So prepare yourself and common questions to ask when you go see them. So write your list of concerns and symptoms to share, including how long you've experienced them. Have key information about your family history. Again, it just makes the visit go better when you have all these things ready to go, because again, you're coming in there and you're thinking this person's right looking at you. That's this person who less intelligent, who doesn't know what they're doing or doing. So when you have all this information, it's very impressive. Okay. Create a list of questions you want to discuss. Again, but I want to say, when you go see your provider, we're not going to address everything at the first visit. Okay, especially when it comes to primary care providers, where you have to know everything. All right, everything about that patient. So, but we cannot address everything. You have the 30 minutes that you're in there. We cannot address everything. So try to find the most important ones. And if I say, I'm not addressing that today, mainly because we have to go in order of priority. If you're having dizziness and your foot hurts, I'm going to be thinking of the dizziness. I'm not looking at the foot. Not saying the foot's not important, but which one is going to keep you alive for the next 5 minutes, or you don't have to go to the emergency room. That's the one I'm going to concentrate on. And I can say, come back. And some people might say, why didn't you take care of everything right away? No, I can't. Let's take care of the most important ones. We have to prioritize our treatment. Okay. So the same way if you have children at home and somebody's cutting and like fighting, and then one person's like hanging up on the side of the chair, or walking close to the over to the pool, you're gonna concentrate on that person first. Okay, so we're trained to like prioritize. All right, anything their airway, breathing, circulation, we have to make sure I'm gonna do that first. So we can, but get your questions and everything together. Complete your paperwork in time. Do that in time. Most places will send you their thing if you have computer access. We send it to you. Get that work done before you get there, because you're gonna be saying, why can't I see the doctor right away? Why I have to do all this? get all the paperwork ready before you get there, so it just makes it go smoother. So when you come in, you're not waiting as long. There may be a chance that you may wait a little longer because somebody else took a little longer, but at least you have that ready, and it just makes it easier for you to come there and be ready to go. Okay. Bring someone with you to help you take notes, because when you sit in there, especially if you're talking something really serious, the other person, yeah, at least you have somebody there to listen. Sometimes I say have somebody on the phone. And again, like I talked about, when you have young children who are like maybe 13, 14, and they don't want to go to the pediatrician's office anymore, they want to be to the big boy, big girl doctor, you want to be there the first visit, especially when they're still like 13, 14. But when they're, even when they're up to like 19, 20, and this is their first visit, please be there to talk to the doctor, to the provider right away, to and talk with them, to have that conversation. If they want you to wait in the lobby, you can do that, and they can call you if they need any additional information. But it's very important because they don't remember all those different things. And especially if you say, okay, would they look at my black son that way? Would they look at my black daughter that way? Be there to be their advocate. Okay. So, and again, some of the questions to ask, I think I got that there. What could be causing your symptoms? What conditions we can explore? So you want to be a part. You want to be an active participant in your care. Don't just sit there and then when you just sit in there and you don't say something. Because we go through everything when I write the testing and the labs and all that. Then I do ask my patients, is there any other question you want to ask me? Okay. Anything else that had to do with what we just talked about today? Sometimes it's like when they come in and if you're going for a follow-up, especially if you're going for a follow-up visit, don't come with 10,000 other complaints, because again, we're not going to be able to take care of everything. Okay. Because you come in there, okay, there's different visits for follow-up visits, for problem visits, for reviewing your labs. And sometimes we kind of, saying this is how long you're going to be here. So when you see those things, it's very easy to come across and saying, okay, they're doing this to me because I'm a different color. They're doing this to me because I'm an immigrant. They're doing this to me because of that. And sometimes that has nothing to do with it. I'm not denying, again, like I say, everybody has their own biases and they come into that. Okay. So, but once you come prepared and you know what you're doing, it just makes the visit go a little better. We're not expecting to be perfect patients. You're sick or you have other issues going on. You have other things going on in your lives and all. So we're not expecting you to be like, okay, make our lives better. It just makes your life better when we can sit there and have a respectful conversation and you have all the information that we're asking for. And you have an open mind. The most important thing is having an open mind. Okay. Let me see here what medications you need to treat and then talk about different things. Okay. So let me get to here. I don't see any new questions. I'm going to go in here for a second. I don't want to miss my place, so I'm just going to go back. So, and you talk to your doctor, like, what can I do? Do I need to take any medications right now? I know you told me that this is what I'm looking at. Can I do something else besides taking the medication? Because some people are really medication weary. They don't like, oh, no, 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 no. And I look at this, I say, you're walking out of here with your numbers, you're walking around, you're going to be a walking heart attack. Okay. You're walking stroke. So you need to go see this other doctor, or you need to take this medication, and you can't force them to do it. You go ahead, and some people, again, they come in with their own little beliefs, religious beliefs or cultural beliefs. Oh no, I can just put this on me. I can put this cream here. And you have to respect that. As a provider, we have to respect that and document it, but respect that this is what they want to do. Okay. So what else should you consider? So healthcare involved much more than spending time with your provider. So making sure you do all your paperwork. Like again, like I said, get all your paperwork out of the way, check your insurance and all, and lean on your support system. Okay. So let me go in here, express your needs. Lean on your support system, making sure you bring in a friend with you if you have to. Bring a friend that will tell your provider that you can, what you're concerned. You can say something like, it's important to me. It's important to me that you understand my symptoms. I want to make sure we're on the same page about my symptoms and how to address them. So I usually tell my patients that too. I'm like, okay, this is where we are. Sometimes like I said, I would literally turn the page, my computer, and say, let's look at your numbers and see, this is the range of where you're supposed to be. This is where you are. Let's work together. Okay. So become a partner with your healthcare provider, because I said you have to be an active participant in your place. So when they see that, they respect that. Okay. You shouldn't have to jump through hoops to be respected at all. I'm not saying that, but you being an active participant, whether you see a provider that looks like you, talks like you, or whatever, from the same cultural background, whatever, be an active participant and ask the question respectfully, and they're supposed to respond respectfully. Okay. So, and let me go here. I don't want to keep you guys too long. So when do you, and again, when you see somebody and they tell you, maybe I don't understand that. Maybe that doesn't sound like something I want to do. So when to seek a second opinion. So So you want to feel sure and supported when you see your doctor. Okay, so when to seek a second opinion, because you might say, oh, they're telling me this, and they're just doing that because I'm a different color, or they me saying something, and this goes to anybody. Okay, so if you want to seek a second opinion, I did do a show on I want to seek a second opinion. So some of the times you should seek a second opinion when you feel uncomfortable with your provider. Okay, not I just don't like him. Just something about it don't sit right with my spirit. Usually, sometimes if that's the case, find a different provider, because like they say, okay, you can feel the vibe. Okay, you experience, and if you experience anything, any kind of the way to talk to you, especially we perceive, if you're a different race, you perceive racism differently, because you've seen it around, how other people may not see it that way, and they may come across, and sometimes you may say, okay, stop, I don't feel respected right now, I need you to stop, just stop and let me talk, or stop and don't talk to me that way. You have a right to say that. Okay, regardless of what is in the doctor's office, and especially when you're in healthcare, you're already vulnerable, you already have problems that you're dealing with, you don't need to be dealing with anybody like that. And sometimes we pull people to the side and say, hello, you pull your partner as another healthcare provider, or staff, and say, maybe you and that person having a problem right now, stop, just go walk away for a little bit, breathe it out. Okay. Alrighty. And sometimes, like I said, people used to say things to me where we're the same color, and they would say stuff to me, and it's like, oh, okay, no, because you can be in the same race but a different cultural background, and they can come across that way too. All right. So your experience racism during an appointment, your provider isn't listening to you or taking your concerns seriously. Your provider doesn't request adequate screening and testing. Remember to also the insurance coverage. So we may say, okay, we want you to do this, this, and this, but insurance coverage might didn't cover, your coverage doesn't cover all that. Also, sometimes you may say, okay, my knee's hurting. We have to say, get X-ray first, and we'll send you to orthopedic. We're not going to do MRI, because the insurance company is not going to have you do an expensive test. If the X-ray, that do the X-ray first, making sure nothing's there, send you to orthopedic. When the orthopedic doctor, the bone doctor, says yes, we need to do the MRI, which is very expensive, which is more definitive testing, then they can do that. So again, understand everything, do your research, so when they say stuff, you don't first thing jump to, okay, I did doing that because I'm this. All right, you're adhering to treatment, but still you're not feeling well. Okay, everything they've prescribed for you so far, and you've done it, but it's not working. You'd be like, can I just check with somebody else? And of course, when you're having a second opinion, check with your insurance company to see how the second opinion works for your insurance company. Okay, and you are diagnosed with a really rare disease, because if they tell you something and you go read about it, and they say only 6 in 10 Americans, or only 200, or a handful of Americans have this disease, you'd be like, okay, all righty. Let me go check more about that first, and then we can do that. It's good to. That's when you really want to get a second opinion, and also when you're diagnosed with cancer too. That's of course you want to get a second opinion too. And no provider that respects their license would say, "Oh no, that's disrespectful." No, go ahead. You're free to get a second opinion. You can do that. All right. So you're the best judge of you whether something feels right about you. You know how it is, and you know when you're getting somewhere. And it's like getting a second opinion doesn't mean you're insulting the doctor. You just want to know a little bit more, because remember, sometimes two doctors in the same practice could look at something differently too. It's not going to be vastly different. One's not going to tell you you have cancer, and the other person's going to tell you you don't have cancer, because sometimes when they do certain testing, the radiologist might say, we see something that we're not sure of, we want you to get additional testing. So if I tell you they saw something on your test and they want to do something else, and my partner saw you 2 days later and say, oh yeah, they did the test and everything was fine, doesn't mean I lied. It just meant that they wanted to do some more testing, and they found, and when they did the testing, whatever they found was there, it's not actually what it was. And sometimes it wasn't there before, and when they did the test a couple of months later, it grew to where the test was able to pick it up. The same with mammogram, you can do your mammogram many years, and all they couldn't find anything, because they do tell you there's sometimes your breast is so dense that certain things they can't find, but over time they may be able to find it. Doesn't mean that they were doing it wrong all along. That's why it's important to get your mammogram consistently. Okay. So, in summary, I mean, the most important thing, again, Black History Month and all that. So, it's important that we all, because of the lived experience, when you see a provider, it's very sometimes, you're not going to be able to see, most that's not, I think the survey I think like most doctors, I think doctors of color and all that too, like average no more than like maybe 10 to 15% of all the medical providers in the country. So it's important. And sometimes you would never get to meet a doctor that looks like you, okay, or from your cultural background or your racial background. So it's important. That's why most schools and all that to trying to teach cultural sensitivity, and we do a lot of continuing education on that. And sometimes you may have to teach your doctor or your provider again how to talk to you. Some people just to be like, and again, I said that when you finding a new doctor, explain that. Say, I came here before, and the way you talked to me, I didn't really appreciate it. And and that person may step it back and say, "Oh my goodness, I'm really sorry. I didn't know you. I didn't think you took it that way. I did. That's not the way I meant it." Because that person is like living a different reality, not so much different reality, but they may say something that other person might say, okay, that's not how I see it, but bring it to their attention. And there are times too when I say something, I may say something that may be culturally insensitive to somebody that another culture doesn't find insensitive. So when they tell me, okay, I didn't like that, or when you do that, I have to get to the point and be comfortable in myself and in my profession and everything to say, okay, I'm sorry. What can I do better? What can I do it different? And for you providers out there, social workers, physical therapists, all those other people, okay, you will all do the same kind of training when it comes to cultural sensitivity. And employers, you need to bring that, get your employers there to CNAs, dietary people, because there are times the patients have problems with people working in the hospital and things. And it's very important because when you don't treat the person right and the person doesn't speak up, somebody could be having a stroke or having something else, but because they're too afraid or they do you looking at something else differently, and that person could suffer devastating consequences because you chose to see them differently. Okay, the country right now is so charged. Okay, and sometimes it's like people are like, oh my god, everything racism, 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 health disparities, and prejudging and all of that exists in every profession. Every profession. It's not just, oh my god, you go in there and it hurts that when in the profession where when you're feeling sick and you're vulnerable, you need somebody to help you, but it does exist. That's why it's incumbent upon you as a patient also to say, to speak up for yourself, know your rights, know your insurance coverage, know your family background, do everything that's going to make your visit, make it easier for you, and also for employers and providers and people who work in the healthcare system also to try to go to a lot of sensitivity training. There may be times where you be like, oh, why do I have to do this? Why do I have to do that? But you're taking care of somebody who trusts you, who literally putting their life in your hands. Okay. So, and for those of you who are doing it right, yay, yay, yay. Many doctors. I have many doctors friends. I have many friends in the health field and all that. Sometimes we sit there, we laugh, we make like stupid jokes and all. It's like, okay, so you just thought that because I'm black, I'm gonna do that, or because you think I'm white, so I'm gonna do that. So we laugh and make things funny. And it's most important to like just laugh about certain things. You can be serious all the time. Okay. So let me go in there. But so the most important thing, like do those things that's gonna help your care better. Okay. And make sure that you get the best care that you need. So let me just go in here for a second and see. I don't want to make this too long. Okay, wow. Okay, so all right, you see some of the questions. It's like doors like slow to English that we're Liberian people. I'm sorry. I'm sorry. Okay. Jackie Jackson says search for your local free clinics. Yes. If you don't have insurance, check your local free clinics. You can get a lot of different coverage. And when you're in the hospital too, there's social workers, the medical social workers, and also the care coordinators. They have all the different services. They know all the different things in your area. Those free clinics are really good, and they'll call ahead of time too, because for most of them you have to go there very early and you take a number, and so you don't want to just walk in there late in the day. You want to be there very early. Okay. And some of them do charge a small fee, but but so call first and get the information. Okay. And Jackie Jackson said, can you kindly, oh, Jesus Christ, great topic and trying to take information. Yes, please, Miss Social Worker. I try to try to keep this longer. You know how people on the internet, their attention span is so short. Right. And so, yes, yes, yes. Okay. So, yes, my cousin Jackie is a social worker, by the way. So, I got to talk about different social workers and all. I think I got everybody's stuff there. Okay. So, but it's important. And all of the, again, like I said, in honor of Black History Month, a lot of Black people did a lot of things for in the health field, and also a most important thing, again, like I said, just to summarize, making sure that you know everything you're supposed to be knowing about your history, actually ask those important questions, especially for heart disease, cancer, and let me go back in here. Get there in time, fill up all the information that you can fill up. If you're taking somebody, especially if you're taking an elderly person, to making sure that you get there on time, because they're going to be already, don't want to be there, or they're afraid and all. And people who don't speak English right, please, tell the person that we do have translation services. And for providers like me who speak a little fast, I'm sorry, some of my patients will tell me, slow down, slow down, slow down. And for those of us, there are people who speak really slow, and there's some people who speak really fast. And just say, can you just slow down a little bit, please? And of course, you slow down a little bit. All right, there's nothing wrong with that. Okay, so I don't see any more questions there. But the most important thing is making sure that you become your own advocate. And if you don't feel comfortable with a provider, you don't feel comfortable with a medical assistant staff and all that. And if you're in a hospital, also, you don't feel comfortable with the nurses and all. There are nurse navigators, there are patients advocate. They can come in there and they can get your complaint and take it to the next level. And you can still complain to even higher up people than that. Okay, so they may say, they make them unit manager may come into the office, into your room, and say, okay, this, and if you don't feel comfortable with his or her answers, you can still go over them. You can ask for the DON when you're in the patient office. Sometimes when you're in the doctor's office, and you say, okay, I want to speak to somebody higher, it may not happen right away, because not everybody's there present in that office. And sometimes we have to get the patients moving, because especially when we have patients in all the other rooms and some waiting in the lobby area, that may not be the best time to lay your complaint. So you can always call back and schedule a time. And we document everything too. We document any complaints that you had, because the most important thing is when we do write for your treatment, we want you to be able to feel comfortable to take the medicine that we prescribe for you, or go get the testing that we prescribe for you, so you can take care of yourself to get the best outcome. All right. So those are the strategies to tips to help yourself. Like I said, this article, I saw that and I love it. So I'm giving credit to the person who wrote for it, and I just added my personal touch. So any other questions there? I don't see. I think I got everybody's questions. So of course, like this other blogger said, well, let's continue the conversation in the comment section. If you had any more questions or comments, just leave it there. If you have anything that you need to inbox me, ask me any questions, you can just inbox me through the forum inbox stuff there. Okay, so thank you all for watching. For those of you who are watching now, I say thank you. Please click like. If this video has been helpful to you, keep it, show it to somebody else who it can help at any time. And if you haven't liked and followed Abby Tyler's Healthy Living, please do so. In March, it's going to be tomorrow, so happy March in advance. And next week, Tuesday, I'll have a good show. We're going to be talking about religion and science. I have my good friend who's going to be on. And for those of you who, talk about religion and science, how they can coexist safely, he's going to be with me next week. So I look forward to that. So I hope you will join me. Please share the show. Please share the show. Please share the show. For those of you who say I speak fast, I apologize. I'm a fast talker. I do have some people who speak really slow, and I sit there and I'm like, oh my God, you talk so slow. I don't say it to them though, but please, excuse me, show me some grace. Okay. But thank you all for watching, and I will catch you guys later next Tuesday. And I also do Abby's daily dose too during the week. Okay. So thank you all for watching, and I will talk to you guys later. I think I said that already. Good night. God bless.